Hello, and welcome to our June keynote. I'm your host, Elizabeth Moore. Earlier this month, Dr. Martin Karpeh helped us kick off Men's Health Awareness Month, explaining the importance of men taking charge of their health. In this month's keynote, Dr. Karpeh talks about his participation in a panel discussion, The Unspoken Truth, about the heightened risk of prostate cancer among Black men. You recently participated in a video with Northwell and the American Cancer Society about Black men and prostate cancer. Can you tell us a little bit about how you got involved?
Yeah. We wanted to bring attention to the fact that prostate cancer does affect Black men disproportionately, and they tend to get a more aggressive disease. It was also Prostate Cancer Awareness Month, so kind of made sense to do it then. But we really want to explore a lot of the reasons why Black men don't seek medical care. And so we know that in general there's a general lack of trust amongst Black Americans in the healthcare system for many, many reasons. And seeing other Black men at various ages and different parts of life that have dealt with prostate cancer and come out successfully on the other end was a powerful message. And so when I was asked to participate, I was very happy to say yes.
Yeah. And then you did have an amazing lineup of, you had the NBA star Allen Houston, a pastor, Reverend Malcolm Bird, a scientist, Lloyd Trotman, who specializes in prostate cancer. What did you hear from them, from the survivors? Like, what was your takeaway?
Yeah, I mean, what really impressed me were their individual stories and how many of them sort of overcame a lot of the biases that, it won't happen to me. And they were pushed to see their primary care physicians, and were told that they had an elevated PSA, which is a screening tool for prostate cancer. And then how they handle that information. It's common to kind of suppress that and put your head in the sand and just hope that it goes away.
Right.
But these gentlemen were pushed oftentimes by a spouse, and they went ahead and got investigated with an MRI, which then showed a lesion on the prostate. They got biopsies and were able to get treated.
I loved how Allen Houston said that he did it for his family.
Yeah.
Like he said he owed it to them. And we talk about that a lot here, that finding your why for taking care of yourself is the best motivator.
Yeah.
And I loved Tony Hillary, the Harlem-grown entrepreneur. He said that he was sort of numb while he was listening to the doctor, but his wife was writing everything down.
I see. That's a very common scenario. And oftentimes I'll see a male patient and they may not say a word in the whole interaction, but
we've got their back.
Their wife has all the information. So.
Well, that's great. We look forward to seeing the full video soon. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.